Hi, I would like to welcome you to Caring's latest webinar. As many of you know, November is both Alzheimer's Awareness Month as well as National Family Caregivers Month. Both observations are dedicated to raising awareness, educating the public, and delivering support. In this webinar, we have a guest expert, Ben Yeager, from the Alzheimer's Association, who will share with Caring's network of communities and agencies the latest facts about Alzheimer's disease and dementia to support you in your work with seniors and their families. I'm Denise Grob, a longtime director at Caring, and I'm thrilled you could join us today for this very special event. Before we begin Ben's presentation, I wanted to let you know this is a one-way webcast where only the presenters are speaking. However, you can ask questions at any time via chat or the Q&A, and we'll do a focused Q&A at the end of Ben's presentation to make sure we get your questions answered. And thank you for those of you who submitted questions via the registration as well. I have those summarized for Ben. And then the number one question we get with every webinar, I'll just go ahead and answer right now. Is the session being recorded? The answer is yes. Hopefully you are seeing a red dot on your screen. This is a recorded session. We will be sharing the slides with all of you tomorrow. And for now, I am going to stop my video to maximize my bandwidth and help focus attention on our presenter and his presentation. I will come back on when we do the Q&A. Before we jump into that, one last housekeeping item. For those of you not yet familiar with Caring, and as a refresher for our longtime partners, Caring was founded by caregivers for caregivers. Our flagship website, caring.com, was launched during the 2007 National Family Caregivers Month to help caregivers make better decisions, save time and money, and feel less alone and less stressed in providing senior care. Today, we remain focused on helping as many seniors and their caregivers as possible through empathetic expert guidance, whether through our online resources or via free referral services and consult with our family advisors. We also host one of the highest integrity, longest standing senior living and senior care reviews programs on the web, with over 400,000 consumer reviews published to help families in the search for memory care, assisted living, in-home care, and other housing and care services. With our long-standing expertise and valuable service offering, thousands of senior care agencies and senior living communities nationwide are partnered with Caring to reach a highly relevant audience through digital marketing to successfully grow their businesses and help more seniors and families get high-quality care and support. For those of you on this webinar who are partnered with us, thank you for joining us in this endeavor. Now, as I mentioned, our featured presenter is Ben Yeager from the Western Carolina chapter of the Alzheimer's Association. This is Ben's first webinar with Caring, and I hope you'll join me in a warm welcome via chat or by asking questions to make this event as engaging and helpful as possible. Now, without further ado, I'll turn over the presentation to Ben. Take it away, Ben.
Thank you so much, Denise. And thank you all for coming and for having me as a guest speaker. I am so excited to be talking to y'all. Even those who may have come, I know we did do a similar webinar last year. There really have been a lot of things coming out just in the last year, even a couple of months. So I think that even those who may have come to a talk like this last year will be learning some new things. So I'm really excited. This is an incredibly exciting time to be involved with the Alzheimer's Association, just because there is so much accelerating on the research side of things. And I am really looking forward to share some of that. I think that for me, this is such a devastating disease. It really gives me a lot of hope that, the next 5 to 10 years can maybe look a little bit different in terms of the fight against Alzheimer's and dementia. So like Denise said, I'm Ben. I am the program manager for the Triad region in Western North Carolina. So for those who are familiar with that, that includes places like Greensboro, where I live, Winston-Salem, and High Point, as well as the surrounding region. And I'm really excited to be talking to y'all today, although I know we have a nationwide audience. Um, all right, perfect. I want to make sure I was able to advance the slides. So we're actually going to start. The Alzheimer's Association does a lot of things. And one of the things that we do is every year we introduce a facts and figures report, which kind of gives people a sense of, how do things look nationwide in the US in terms of Alzheimer's prevalence and kind of other statistics. And so this year, our facts and figures report was released at the end of April. So we have data current through then. And the headline was that we have unfortunately crossed a grim milestone, which is we now have over 7 million Americans with a confirmed diagnosis of Alzheimer's disease. In the past, we used to be able to say almost 7 million, but we can't anymore because we are now at, I believe the official figure is 7.2 million Americans with a diagnosis. This also, this includes, or sorry, I should say this does not include people who have never gotten a diagnosis, which, for those of us who are very familiar with this disease, know is pretty common. In fact, I will share from my own personal life. We lost my grandmother to pretty severe dementia toward the end of her life back in 2016, and she never got a diagnosis. So we can't say for sure if it was potentially another form of dementia or if it was Alzheimer's. And so I think there's a lot of people out there like that. It also includes other forms of dementia, or it does not include other form of dementia as well. So the real impact of this disease is greater than just that 7 million. We also know that 1 in 3 seniors currently dies with Alzheimer's or another dementia. That is with, not from. It can be a little tricky at the late stages of the disease to determine, what was Alzheimer's the direct cause of death or an indirect cause. And we know that deaths from Alzheimer's disease are increasing pretty dramatically, 142% since the year 2000. It is also the most expensive disease in U.S. history, with total costs to the economy projected to rise to $1 trillion by the year 2050, unless we are able to make a meaningful change in the trajectory of this disease. Again, I know that we are talking to a nationwide audience, but I will highlight that in the state of North Carolina, for those who are here or familiar with here, we currently have over 210,000 individuals with a confirmed diagnosis of Alzheimer's. So who is the Alzheimer's Association? We are a nonprofit, and our vision is to essentially end Alzheimer's disease across the world, as well as other forms of dementia. So we do a lot of things on that front, and I would say the primary thing that we do is we invest in research around the world. We actually have active research projects in over 55 countries right now. And we invest over $100 million every year into research against this disease. And we're starting to see some real breakthroughs coming from that investment. We now, and we're going to get to a lot of these things, but on the treatment front, on the testing front, on the prevention front, we have things coming out just in the last 2 years that can hopefully make a meaningful dent in some of those trend lines in terms of Alzheimer's. I will also say that we like to say that we kind of punch pretty well above our weight. We are actually the biggest nonprofit funder of Alzheimer's research in the world. And even if you don't, even if you expand beyond the world of nonprofits, we are actually the 3rd largest funder. The only 2 organizations worldwide that invest more in Alzheimer's research are the governments of the US and the People's Republic of China. So again, I think that we are, punching pretty well above our weight. And I will say that in the case of US government funding, we have our hands in that as well. We have a national advocacy team that works with legislators in Washington to advance bills that, things like the BOLD Act that increase funding for Alzheimer's research as well. This may be familiar to many of you, but just to make sure that we're all kind of on the same page and we're all using language in the correct way, when we say Alzheimer's and dementia, these aren't quite the same thing. So dementia is actually an umbrella term that refers to all different kinds of memory disease or loss of cognitive functioning. And that includes less common types of dementia, such as vascular dementia, Lewy body dementia, frontotemporal dementia, as well as dementias related to other diseases like Huntington's or Parkinson's. But the reason that we're called the Alzheimer's Association is because Alzheimer's is the most common type of dementia by a pretty significant margin. So we currently believe that about 65 to 80% of all dementia cases are actually Alzheimer's. Um, so it's by far and away the most common type, but the Alzheimer's Association is focused on other dementias as well. When we think about Alzheimer's in particular, Alzheimer's is a brain disease. It is a progressive brain disease, which means at the onset of symptoms, an individual declines over time, usually over the course of about 10 to 15 years. Although, as with all things, this is a very weird disease. So some individuals may decline faster or slower than that. And it's a disease that causes changes in a lot of things, from memory to behavior, to how social somebody may be, to their judgment, to their spatial reasoning even. So it can change things in a pretty profound way. By the end of that disease progression, it interferes with things like breathing and swallowing, which often requires individuals to be on life-saving treatments to continue to live at that point. And it is ultimately fatal. In the early stages, memory loss and other symptoms are often pretty mild. So people who are in the early stages of Alzheimer's, they can often live pretty independently. They may not need around-the-clock care. They may, be safe to, run errands and kind of go out. But of course, that will change over time, and they will struggle progressively with things like, bathing, eating, things like that. We also know, and this is going to become really important when we talk about treatment and testing, we know that Alzheimer's, we're not 100% sure if these are the total sum of biological causes, but we know that there are biological hallmarks associated with this disease, which are beta amyloid plaques and tau neurofibrillary proteins. And those are protein formations going on in the brain that are strongly associated with the onset of this disease. And what we know is that those beta amyloid plaques start to form first. And in fact, what we are learning is that they can be forming potentially up to a decade before the onset of any symptoms. And that's scary in some ways to think that there could be individuals out there who are their brains are starting to change, are starting to contract Alzheimer's, but they may show little to no sign of memory loss or any other kind of cognitive decline. So it is scary, but we also think that that's an opportunity to potentially catch this disease earlier and to make meaningful interventions in those individuals' lives. I should have also mentioned that those tau neurofibrillary proteins, those tangles essentially, those tend to form much later in the process. The plaques are associated with the early stages, the tangles with the later stages. A lot of other people ask, does Alzheimer's affect everybody the same? And the answer is no. We actually know that Black Americans are about twice as likely to have Alzheimer's as white Americans, but are actually less likely to receive a diagnosis, which I think is a very significant challenge. And for Hispanic Americans, that rate is more than about 1.5 times. For women, the numbers are quite similar. About 2/3 of those living with Alzheimer's are female. And we know that women are impacted beyond that because when we think about caregivers, people who are, and when I say caregiver, I mean somebody who is unpaid, untrained in many cases, often a family member or another loved one, providing unpaid care for somebody living with Alzheimer's or dementia. We know that the majority of caregivers are also women. So it's a disease that impacts women disproportionately and in multiple ways. Another question that I get a lot, especially when I'm out talking to people in the community, is, well, I'm getting a little bit forgetful. Do I need to be worried? And the answer is, well, maybe, but probably not. So the Alzheimer's Association has identified what we call the 10 warning signs of Alzheimer's. And this is a really good thing to know because, again, being a little bit forgetful, even if we're increasingly being a little bit forgetful as we age, is not necessarily a cause for concern. Memory changes are a normal part of aging, and Alzheimer's is not. It is a disease. Um, so we have compiled this list of warning signs, which is a great reference tool. And so when we talk about memory changes, we're talking about things that are significant enough that they are disrupting daily life. And we're talking about things that when an individual forgets something, that memory may not come back later. So a good example is, let's say somebody's looking at an old photo or a school yearbook, and they may say, honestly, I do this all the time. If I looked at my high school yearbook, I might not remember a lot of the people in some of those pictures. um, you may not know that person's name, but if you thought about it, it might come back to you later, maybe in a couple of hours after you've thought it through. Or, you could be a little bit forgetful in terms of knowing what day it is. You could go the whole day thinking it's Tuesday and then surprise, it's actually been Wednesday the whole day. Those things where you're remembering things later, these things are often pretty normal, especially as we age. But it's that severity where it's disrupting daily life that is potentially a warning sign for something more serious. It also includes things with, confusion in time and place. It's common for people with Alzheimer's to wander, to get lost, even if they're going to, the grocery store that they've gone to for, 50 years or something like that. It can include misplacing things and struggling to find them, especially in strange places. Again, we've all put the keys down in a weird place, but if we think about it and we kind of retrace our steps, we can find them. But we never found our car keys in the freezer, something like that, where it's in a particularly unusual or even, I would say, bizarre place could be a warning sign for something more serious. And I think knowing these warning signs is going to become more important, because I will say that I think one of the biggest challenges that we face in the next 5 years or so is early detection. How can we get people diagnosed with this disease earlier in the process? Thankfully, and this kind of brings us to, I will say, our first major update, is we got huge news this year, in that the FDA, in mid-May of 2025, has now cleared a blood test for use in diagnosing Alzheimer's disease. And we are really excited about this. Blood tests are way less invasive than anything else that is currently used as a diagnostic tool, which includes things like PET scans, MRIs, spinal fluid extractions, things that are, quite frankly, very expensive and costly and also invasive for individuals. Blood tests could potentially, if they're widespread enough and covered by insurance, they could potentially be a much cheaper and accessible way of diagnosing Alzheimer's. And how these blood tests work is they are specifically looking for buildup of beta amyloid in the brain. So for those who remember a couple slides ago when I was talking about those biological hallmarks, those are the plaques, the things that tend to be more associated with the early stages of Alzheimer's. So these blood tests could be used to catch some of those people who have plaques forming in the brains before they even experience any loss of memory. So these could be game changing. I think that a big challenge, of course, will be having blood tests widely available across the country. So, I know here in North Carolina, for example, we have for those who are familiar, we have Atrium Wake Health over in Winston-Salem. They're kind of a big national leader in terms of Alzheimer's research. And I know that at Atrium Wake Health, I know that blood tests have really kind of taken over. I had lunch with somebody who works there, and she said that they've almost done away basically with PET scans and the spinal fluid analyses, which is really exciting to hear. But again, I even here in Greensboro, I'm not sure if our local hospital system is quite there yet. And outside of kind of this immediate area, a lot of people, even providers, may not necessarily know that they exist. So I do think that will be a pretty central challenge. Another challenge will be affordability and access. Again, this is going to be North Carolina specific, but I know our state advocacy team is actually working on or rather is advocating for trying to advance a statewide bill that would require private insurers in North Carolina to cover the blood tests. And I imagine that our chapters in other states around the country may be doing something similar. So I think that these are a real opportunity to change the way that Alzheimer's is diagnosed in this country. I think that if we can catch this disease much earlier, I think that that will open up a lot of opportunities to potentially change the trajectory for an individual. And I think that one of the reasons why this is so important is we now have treatments that can slow the progression of Alzheimer's. So these treatments are not new as of this year. They were, I believe, they were approved by the FDA in 2023 and 2024, respectively, Leqembi and Kisunla. But these are very new and they work in a very different way from previous medications and therapies that target Alzheimer's. So existing medications alleviate symptoms, which can be tricky because one person's symptoms may be different from another person's symptoms. So one medication may not work for everyone. These treatments attack the disease on a biological level. So how Leqembi and Kisunla both work is they are infusion treatments, and they essentially, when we start to see that beta amyloid buildup in the brain, those plaques, they can slow the formation of additional plaques. They cannot reverse what's already there. So again, these are, I want to be clear, these are not cures. They do not reverse decline. They simply are, they don't even really prevent decline, but they are slowing it meaningfully. Again, these are not new as of 2025, but what we are seeing is more real world data. In clinical trials, these treatments, for the entire, clinical trial population, slowed disease progression by 6 months, which, may not sound like a lot. But as more real world data comes in, we're starting to see a much stronger effect for people when it's caught earlier. So again, people in those very, very early stages of the disease, potentially, a year or more of slowed disease progression. And again, I think that as more data comes in, we may see an even stronger effect. Like it could be years that these treatments are giving people back. Unfortunately, the real world data is also showing limited and potentially really even no effect for people in the late stages of the disease. And that's because, again, the plaques are associated with the early stages, the tangles, the tau proteins with the late stages. So these treatments are not really designed to do much for individuals with advanced severe Alzheimer's disease. But there may be more treatments in the future. One thing that I will share in terms of kind of the latest and greatest, and this was announced at our international research conference back in July. One thing I'm really excited about is that first treatment, Leqembi, they're actually working on a version of that that could be self-administered in the same way that like a GLP-1 could, like Ozempic or insulin or something like that. Currently, these treatments have to be applied in an infusion center or a hospital. So we're really excited about that. Apparently, the maker is close to being able to roll that out. And again, I don't know exactly what that would do to the total cost of Leqembi, but hopefully it would, kind of bring that down and make it more accessible for people. Another thing that we are excited about, and this is sort of the third pillar, I would say, of things that we are excited about in terms of the latest and greatest, is brain health. So we've talked about the importance of early diagnosis. We've talked about breakthroughs in testing. We've talked about these treatments, but really that third leg is prevention. And we are seeing more and more evidence that lifestyle factors could play a significant role in an individual's risk for contracting Alzheimer's. We don't know for certain, but we currently are estimating, our researchers believe, that about 45% of an individual's total risk profile comes from their lifestyle habits, not from their genetics, not from their age, but from the choices that they make day to day. So when we think about brain health, I will say that probably the one thing to remember here is there is a strong connection between heart health and brain health. A lot of the things that the Alzheimer's Association recommends for prevention are things like, um, protecting our hearts. So things like, managing diabetes, managing hypertension, things like that. Um, and one of the things that we are really excited about is so again, I mentioned that international research conference. The big finding of this year in July 2025 were the results of the US Pointer study. For those who are unfamiliar, the US Pointer study is the first multi-year nationwide study that looks at these preventative healthy habits and whether they can make a meaningful difference. So again, took place over the course of several years. And it looked at individuals who were considered to be at high risk for contracting Alzheimer's, advanced age, little to no physical activity, very sedentary lifestyles, and uh, poor diets, essentially. And it looked at, well, what if we get these individuals to start following a Mediterranean diet? What if we get them to start incorporating, 30 to 35 minutes of exercise multiple times a week? And what if we also had them challenge their minds? We actually had them download an app called Brain HQ. It is a paid app, so I want to be clear here. This is not an endorsement. I'm simply saying that this was the app used in the study, but it was kind of like those daily kind of brain exercises and things like that. So this was a nationwide study, and the results that were presented at the end of July of this year was that these individuals, through those three things alone, lowered their cognitive age by up to 2 years, which is a huge finding. And it's the first time we have conclusive proof in the United States that lifestyle modifications can protect our cognitive health. So I do think that this is a really important element of what we do. And I think the Alzheimer's Association is going to be focusing more and more on brain health. The testing and the treatment, these are great, but also, can we prevent people from needing them in the first place? Maybe. I will also say again, for those who are in or are familiar with North Carolina, there's a little bit of hometown pride in this study because this study, it was nationwide, but it was actually led by a small number of research institutions, one of which was Wake Forest University in Winston-Salem. So there's a lot of hometown pride, and especially kind of in the Triad region. So I'm very honored to be kind of in this space and kind of working alongside really a nationwide leader in Alzheimer's research. So again, the U.S. Pointer study kind of focused on these three things, but we also know that there's evidence for a wide variety of healthy habits for the brain. And again, a lot of them are also good for your heart because there's such a strong connection there. So that includes the US Pointer things like, getting good physical exercise, eating a balanced diet. But it can also include things like, getting good sleep, staying smoke free, controlling blood pressure, even protecting your head. Head injuries are actually, unfortunately, put individuals at a greater risk of developing dementia. So these are currently the things with the strongest evidence for in terms of protecting our cognitive health. This is bringing us, close to the end of our presentation, but I do want to mention kind of some resources that we provide for people. These are great for anybody in this space to know about. And our most powerful resource is our 24/7 helpline. So the Alzheimer's Association has, essentially a team of master's level clinicians who answer the phones around the clock and provide assistance to people living with this disease, their caregivers, or other people interacting with somebody living with Alzheimer's. That number is 1-800-272-3900. And again, anybody can call that number. It could be, something like you have an individual in your care who has pretty severe Alzheimer's, and they're having a bad day, they're having a bad episode, and our clinicians could talk you through some tips and some strategies in that moment for how to help that individual. And again, we are proud to have real people answering the phones, no robots, and it is available every day, any time of day. We also have local support. So again, I'm based here in North Carolina, but we have Alzheimer's Association chapters around the country, and we do education programs like this one. We have local support groups, um, and we are there essentially in your community. I promise. Lastly, I do want to kind of thank caring.com. I know that y'all are partners with us in some of our fundraising efforts. But there are a lot of ways to get involved with your local Alzheimer's association, whether through our walk or through our kind of our new kind of DIY fundraiser, Do It You Love to End Alls. So thank you all for everything that you already do, and yeah, we hope to see you at your next local walk.
Thank you, Ben. I was trying to come back on camera when it moved forward. Sorry about that.
No, you are all good. Yeah.
Okay, great. So we did get some questions. I want to go ahead and open those up. First question we got is you mentioned really exciting news about a blood test. Do you by chance have range of cost on that test?
I don't. I'm so sorry.
That's okay.
I know costs for leukemia and carcinoma. I'm not sure. Like for example, if you didn't have insurance, what a blood test might cost. Although I do know that I believe they are covered by Medicare and Medicaid, and the VA and things like that.
So that's a great thing for people to follow up with the health plan of the senior is find out if the blood
Right.
test is covered and at what cost.
Yeah.
So great. Okay, thank you for that question. We also got some questions during registration,
Yeah.
and there were some themes that came up. And so one of them was, I'd like to learn more about the post-diagnosis user journey. What information and tools would be most helpful for someone seeking memory care?
Yeah. So I will say kind of two things, and this is actually another thing new for 2025 and beyond. The Alzheimer's Association has launched a new free mobile app for people called My ALZ Journey, all one word, although ALZ is capitalized. And again, it's a free mobile app. People could download it at the doctor's office, kind of at the point of diagnosis. And what's really great about this is there's kind of two different pathways for users. So whenever you download the app, the first thing that it asks you is, have you received a diagnosis of Alzheimer's or dementia, or are you caregiving for somebody? And depending on which one you pick, it actually kind of tailors the user's experience to that choice. And it gives you support resources, local and national, as well as education tips based on which one you select. So I think we're really excited about this. I mean, our vision really would be something like, in every doctor's office, wherever somebody's getting a diagnosis, can the next step be you download this app and it can connect them to things like local support groups or education programs like this one. Um, Another thing I will mention is, and actually, this is a partnership between the Alzheimer's Association and the AARP. So there's some really great stuff from that organization as well. We partner on a thing called the Community Resource Finder, and it's a long URL, but it's communityresourcefinder.org. Again, all one word. And it essentially allows you to look for programs sponsored by either the AARP or the Alzheimer's Association, as well as support groups um, based on your zip code. So you kind of plug that in, and then it shows you all the things that are happening in your community.
And then I would add that Caring has family advisors that help them find in-home care or a memory care community when the time comes. Respite is particularly important for those caring for a loved one with Alzheimer's or dementia. So whether it is the in-home caregiver professional from our agent partner agencies or the time to move in, or even when they go on vacation and they need to leverage respite care in a local memory care community. These are options that our family advisors can help after that diagnosis as well. Thank you.
Yeah,
The next question, we got a lot of people asking about this, and so I've synthesized it. So it's a whopper of a question, covers a lot of ground, but it's on the same theme, and it's people were asking about positive communication, engagement, and quality of life for persons
yeah,
living with Alzheimer's and dementia. These professionals in our webinar, they're seeking suggestions for how to keep that senior interested in the activities of daily living, how to best help them and comfort them, Does your organization offer resources for communities and agencies to advance their understanding in these areas?
Yes, absolutely. Yeah, definitely a big question. Let me start with kind of the first piece, which is, are there things that we can do? And the answer is yes. So we actually do have programs about more effective communication. I do want to kind of pause and give a caveat here. Whenever we're talking about the Alzheimer's Association's tips for communication and kind of managing behaviors and things like that, this is really challenging stuff. And whenever I'm talking about kind of what we recommend and best practices and things like that, it's possible to do all this stuff right and it still doesn't go well. I mean, this is a really challenging disease, and I don't want to ever kind of come across as saying, well, you just need to do these 5 things and you're going to be good to go, because that's not true. We do know that overall there are things that can be more effective in terms of communicating and managing behaviors. For communication specifically, some things that we recommend are treating people with dignity and respect, first of all, looking them in the eye when possible, addressing them, by what they like to be called, not nicknames like, honey or sweetie. I say that as, somebody living in the South where that's very common. Um, but again, kind of taking them seriously, treating them like an adult, not a child. It also includes things like, making sure the space is free of distractions. So if you're, in a living area, making sure that, the TV is off. That can be overstimulating to somebody living with dementia. Can include making sure that there's eye contact, making sure that you're speaking slowly and clearly. And also, if somebody has dementia, most likely they're going to be kind of struggling to find their words in some case. And so actually things like not finishing their sentences or not correcting them can actually put them at more ease and kind of assist you in effective communication. So I think that was the first part. And then the second part is, does the Alzheimer's Association offer things? And I would say that at that point, you should check with your local chapter. So again, I know that one of our nationwide offered programs is about communication. I actually did a presentation on this last Monday, so it's something that we offer quite a bit in our local communities. I would check with your local chapter to see kind of when and where they're offering that program. Although we also do, I believe, have national webinars on a periodic basis that you could check for as well.
And is
I
that
think I hit every part of that question,
you
but
sure did. And is that helpline that you shared, the phone number, is that only for consumers or professionals can call that number too?
professionals absolutely can, and they would actually be able to tell you kind of what sort of programs are being offered in your area. And they could connect you to your local program manager if you want to get something scheduled at your facility for staff.
Oh, that's fantastic.
I,
We
I will
got,
say from
go ahead,
I'm
go ahead.
sorry,
I didn't mean to cut you off.
from our end, everybody in my role across the country is it's going to be music to anybody's ears when people reach out and ask people to schedule programs. That's kind of the big part of our job, is to get out there in the community. So I guarantee whoever your program manager for your area is going to be thrilled to hear from you if you want to schedule a program.
That's wonderful. Thank you. You talked about this a little bit, but if there's anything else you want to hone in on, this came up in several questions of challenging behaviors and
Yeah.
how to manage those while maintaining dignity and respect for the individual. Do you have any additional suggestions?
Yeah, and again, that same caveat applies. This is just really hard, and it's in some cases impossible to do things perfectly. Um, we believe that I would say the best place to start is to look at potentially physical things that may be triggering this behavior. So, some common things that you may see from somebody living with dementia is, anxiety, anger, aggression, even, as well as accusations, even kind of wild, kind of paranoid delusions. I almost want to say. So when you see those things, sometimes they can be symptoms of underlying physical needs that aren't being met. Even something simple like, well, is the room too cold or hot? Is it too bright outside? Do the windows need to be, lowered or closed? Is the individual like, are their clothes too itchy? Do they need to go to the bathroom? Do they have or rather, have they had food and drink recently? So, it's not like that's going to solve everything, but it's a great place to start because those are pretty easy to fix in a lot of cases. Um, and again, it's almost about kind of playing detective and trying to kind of fix things here or there. Again, I think that also when an individual is exhibiting some of those behaviors, it's best to try to connect with them as opposed to reacting defensively. So again, I'll actually share a story from my own life with my grandmother. One thing that was really hard is, toward the end of her life, she didn't always know who we were. And I distinctly remember one day where my dad and I went over to her house, and she accused us of being there to rob her. She didn't know who we were, and she just thought we were strangers coming in to steal her stuff. And um, what I did at the time, being, a teenager, was I said, "That's silly. I'm your grandson." I tried to correct her, basically, tell her, "No, you're wrong. This is what's true." But that's not really the best thing to do. What I should have done, and what I know now, is I should have tried to connect with her in an emotional way, and maybe said something like, "Yeah, I'm so sorry. That must be so scary that you're worried. Do you want me to kind of check the doors to make sure they're all locked? You want me to? Is there anything I could do to help you?" And you're almost like kind of sidestepping that accusation and trying to um, show that you are a trusted, caring person. And again, it's hard. It's sometimes that's not going to work either.
Yeah, wow. Thank you for sharing that. We have another question that came in, and it's going back to the original information around the blood test. People are pretty excited about that blood test.
Us too. Yeah.
The question is, what sort of test does a doctor use to determine the diagnosis of Alzheimer's versus the other types of dementia you referenced?
Okay. Okay. So to differentiate, at that point, you'd probably need an MRI because different parts of the brain are affected based on the type of dementia. I think the blood tests are specifically for Alzheimer's disease because they're looking at those beta amyloid plaque buildup, the beta amyloid plaque buildup in the brain. And that is very much a hallmark of Alzheimer's specifically. Um, so typically, the first stage of a diagnostic process will still be a cognitive assessment test. Typically, like 30 questions or so. Um, and it's like you start by trying to remember. They tell you three words, and then they ask you a bunch of questions, and then you have to repeat those three words at the end. I, you know, It'd be awesome if we kind of got rid of that too, and we just had blood tests. But I think right now that will still be the first step because that kind of shows if there's some sort of problem. The blood tests can be great for Alzheimer's specifically, although again, we may see more blood tests for diagnosing other dementias as well in the coming years.
Okay, thank you for all of the information you've provided. And for anyone who thinks of something after the session, we're going to be prompting you with a post-session survey where you can enter your information and request more contact with the Alzheimer's Association to gain. Ben will help connect you to your local chapter, and you can follow up about the information. Also, as Ben mentioned, check with your local healthcare providers if they have that test available yet. It's new and still rolling out. So I really appreciate, I know you're all very busy. Thank you so much, Ben, for all of the information you shared. And for those of you who were able to spend time to come here and hear this latest information about Alzheimer's disease in the United States, I hope you have a good rest of your day. We do hope to hear from you. Take care.
Thank you so much for having me.